This segment is brought to you by the Southeastern Spine Institute. Welcome to Southeastern Studios, where we learn about the latest medical technologies and sit down with physicians who are prominent in their field. All right, I'm back again today at Southeastern Spine Institute with Dr. Ryan Nobles. How are you doing today?
Great.
Wonderful. Now, we got this very interesting looking model over here. Tell me all about it.
So, at Southeastern Spine, as a way to limit your need for surgery, we offer spinal cord stimulation. So, what that therapy is through an epidural needle, we pass a sterile silicone wire that sits outside the spinal cord in the epidural space. It sends a high-frequency electrical signal to the spinal cord, and it blocks the pain signals coming from the low back and the legs. This type of therapy can be used for patients who have back pain and leg pain. It's an alternative to surgery that's much less invasive and it's done on an outpatient basis. In addition to targeting the low back and legs, we can also use a different type of spinal cord stimulator to target nerves that go specifically to the groin and the knee, the hip, and the foot. So your options for treatment are not limited just to the back and legs. We can treat various different conditions using this type of technology, again, all on an outpatient basis.
Interesting. And this also can prevent people from having to take, pain medication, opioids.
Absolutely. Any patient that's had to take those kind of medications for pain, a lot of times the spinal cord stimulator significantly decreases or completely eliminates your need to take any type of pain medication.
Wow. And you said it lasts pretty long too, right?
Yes. The battery is implanted that runs the stimulator, usually in your flank. It lasts about 5 to 10 years, and the procedure to replace that is even more simple. We just make a small incision, replace just that component, and then you're back on your way and on your feet again.
Nice. But of course, there's so many other technologies that you guys work with to help prevent and stop pain. Tell me about them.
So another procedure that we can do here specifically is called rhizotomy. What we do is we treat the joints in between the vertebrae of the low back. So we have a needle with a special tip that comes down right outside the joint. We numb it up. The tip of that needle heats up and cauterizes the nerve that goes into the joint. That can give you relief of back pain for up to 6 months to a year. It's a procedure that can be repeated, and it a lot of times prevents patients from having to proceed with surgery.
Say you have a patient coming in with pain. What do you do? How do you handle it? Walk me through the process.
Most of the times the patients will initially be evaluated by the surgeon. Depending on if they have current imaging available, we can get them downstairs the same day for an MRI. Once that's done, the surgeon will review it and determine if they're a surgical candidate or if they would be better served by having some interventional treatment. If they would, they can send them down the same day to have an injection of whatever needs to be treated that day. So everything can be done under one roof in one day.
That's one of the benefits of Southeastern Spine.
Correct.
Now, you were also saying that it's very much a collaborative effort, that you guys teamwork makes the dream work here.
Yes. So the surgeons and our offices are all in the same hallway. If they need me for anything, I can usually see a patient the exact same day, and we can get everything done that needs to be done.
Thank you for joining us for another segment from Southeastern Studios. And as always, you can go to southeasternspine.com for more information.